This week, we are going to be talking about safe travels.
Yes, you guys probably have seen our Puerto Rico vacation vlog. And of course, we were being safe out there.
Of course.
Wearing masks. The plane safety is what we're going to focus on today. So Stay tuned.
Hey you guys, welcome back to Nurse Talk. I'm Kim.
And I'm Dira.
So since you guys are still here, that means you want to know how to stay safe when riding on a plane during a pandemic, right? So we are going to hit you with stuff that they've already been saying, but since we're saying it, it's right. So first things first, we already need a mask, a standard mask to fly, just like so. So you need a mask. Have a mask. Make sure it's not just a cloth mask, it's a mask with a filter. That's one we would definitely suggest.
How should we wear our mask, Kim?
Glad you asked. Proper ways to wear a mask, guys, are like this, all right? So you want to put your mask on, and then you want to pinch at the bridge of your nose so it conforms to your nose.
Exactly.
So now, as you can see, I'm fully protected from all sides.
Mm-hmm.
I've seen people wear masks like this. No, I've seen people wear masks like this. This is not a chin strap. This is a mask. So this is how you guys should be wearing your mask on the plane at all times. Right. All right. So what we did for extra protection is that we also wore N95. We also have these. I'll put it on to show you.
Now the N95 usually has two straps on it. So there's one that you secure at the top of your head and one that you secure towards the back. And that's what Kim is doing here to demonstrate.
Yep. And then again, pinch at the bridge of your nose. And then we doubled up.
Yes. So we had both as layers of protection.
Struggling. Where's my ear?
Did you find it?
Hair. Yeah.
Okay, cool.
All right. Boom.
So yes, that's how we wore our mask. Now, like we said, all you need technically is just the first mask, the regular mask. And they're even willing to accept cloth masks, but I just feel like that's just not enough, especially sitting there with a bunch of recycled air. They do have air filters on the plane that they talk about, but it just makes you feel a little more at ease. So, to take it a step even further,
because we're extra.
I know that's right.
We also wore our face shield.
Yes. So now you're getting protected from all levels. So if you have somebody on the side of you that's coughing, block. Okay? If you have it from the other side, block. Okay? And then, of course, from the front, there's nothing that's coming straight into the eyes or anything like that. So this is how we rode the plane. It was completely comfortable, probably for us just because we're used to wearing this stuff.
Yeah, we're used to all this gear, so it was nothing. And also, the flight wasn't too long.
No.
So, and after a while, your lips get ashy, but you're fine. You're fine. Yeah. Nobody can see because you got a mask on.
Exactly. And then some tips as well. You want to make sure, like we were saying, you're wearing your mask over your nose and your mouth, okay? Both of them.
Also, what I would suggest, I know a lot of people get on the flight and they want to have a snack. Limit your food and drink and limit the times that you're taking off the mask on the plane. And also, try to keep 6 feet apart when possible. When you're actually sitting on the plane, they're no longer doing every other seat anymore. So you are sitting next to someone else. Right. But when you can, try to stay 6 feet. Don't try to be leaning all up on your neighbor, especially when you're falling asleep. Don't go like, because you don't know them. You don't know them. So again, let's remember there's a pandemic.
And also, you want to be mindful of what you're touching, okay? Yes, they do clean between, I'm about to say patients. Yes, they do clean between customers, but not to the depth that you may think.
Right.
So therefore, you want to make sure that you're sanitizing the areas, like the high touch point areas, and you want to just stop touching things. So, sanitizer here. We want to make sure that we're rubbing it together, okay? Going around between the fingers as well. People forget that. kind of like you're washing your hands in the first place, okay?
Yeah.
You're just gonna let it dry up, okay? So that's how you wanna actually do your sanitizer, all right? After you touch those high touch points, make sure that you're using that as well.
And the high touch points, you're talking about your armrest, your tray table, anywhere on the plane, even like the window. Make sure you're just sanitizing your hands. Just be mindful. If you touch those areas, sanitize before you go touching your face, taking your mask off or anything like that, because now you're moving the germs from your hands to your face.
Right.
So,
which means it's getting closer to the mouth, the eyes, things like that.
Yeah.
Okay.
You
Which
don't
is
want
kind of
that.
gross. And finally, you want to make sure that you're washing your clothes once you get home, because obviously when you go to a destination, you're not necessarily going to have a washer and dryer.
Right.
If you do, great, go ahead and go for it. But if you don't, you want to make sure that you wash your clothes when you get home.
Yes.
Okay, because the airport clothes have been touching on everything and everybody, okay? How many butts have been in that seat that you sat in? You know what I mean, if you think about it? So you want to make sure that you're washing those clothes.
Yeah. That pretty much concludes our safe travels video. So again, guys, if you like what you heard, go ahead and subscribe and like this video. We hope that we gave you enough intel so that you can feel safe while traveling this pandemic season. Guys, just make sure that you're staying safe out there. It's okay to travel. It's like we want to go outside. Yes.
Right. Everybody's getting restless. Everybody's ready to vacation again. You can vacation, but just do it safely. That's all we say. As always, like and subscribe.
Yes. And
leave comments down below.
Of course. And come back.
Yes.
All right. Again, we do the research.
So you don't have to.
All right. Well, I'm Kim.
And I'm Dira.
And this is Nurse Talk. And we are out.
Bye.